So let's do some hands-on demonstration using the NVPRO3 diode laser from Denmark. And if we haven't demonstrated this already, we're going to turn it on, and it will give you a password that you have to use. Here we're just using 4 checks. So now it's on. And what I want to do is go through the various procedures. And remember, we said that there's settings that are preset on here. It makes it very simple. So the little light blue menu bar down here, if you press it once, it'll say laser mode. And if we press it again, it'll say procedures. Now we have up and down arrows. If you press the up arrow, let's all do this together. The first one says Aphthous ulcer. That's the procedure. If you press the menu one more time, it'll be 1.4 watts. And we will use a non-initiated tip, and this is how the tips are packaged. Just kind of slides on. And again, we're at 1.4 watts, non-initiated, meaning we're not putting it in the cork. And it's in the pulse mode. This is all preset. So it's fairly simple to use once we get the habit of knowing what the presettings are. And we'll practice this. And so we said the first one was Aphthous ulcer. And to treat an Aphthous ulcer, it will kill the bacteria or the virus. There's very little or no discomfort. And what will happen is you'll just get faster healing with no anesthetic. We do not touch the lesion with the tip. And you can turn it up to 1.5, and sometimes the patients will feel a little tingly. So you have your foot control, and let's just pretend that we have a lesion there, and you can hear the pulse. You can hear the pulse, and you're not touching the lesion. You're getting 1 millimeter, 2 millimeters away. You can stop. Sometimes it'll feel a little warm to the patient or tingly to the patient. And that we can take care of a Aphthous ulcer or a herpetic lesion. This has been a big thing in our practice. If you've ever had a little herpes or cold sore, when it first starts to bother you, you can come in and we can simply, again, use a pulse near the tissue, not initiated. We're not touching the lesion whatsoever. Let it stop for a little bit and we'll be in great shape.